how can schools effectively collaborate with mental health professionals and external agencies? This question is one that right now is really at the forefront of my mind because my master's level students and my postgraduate students are ready to submit their assignments where they are looking at that effective collaboration between schools and mental health professionals. We know that with effective collaboration between schools and mental health professionals, we can dramatically improve the support for students, especially those with complex needs or with mental health issues and challenges. The students have had to create a map of the external agencies and the mental health professionals that are available to their particular setting. And for them to have done that has really demonstrated to them what services are available and what avenues there are to explore. So even if they aren't able to access some of those more high profile agencies such as CAMS due to waiting lists, etc., they've been able to sort of realize that there are other avenues that could be explored. What they now need to do is to ensure that all of the staff within their setting understand what that referral pathway looks like. So they need to establish a clear referral pathway. They need to create a simple, transparent referral process for staff to escalate their concerns to. That first step might well be having the designated mental health lead or a senior mental health lead or your safeguarding lead be that person who acts as the bridge between the school and the external services. So the teacher escalates the issue to one of those lead practitioners. They then follow the protocol around their policy and practices in relation to those external agencies and mental health professionals. For that person who's building that bridge, part of that bridge building does include building really strong and cohesive local partnerships. Relationships built on trust and communication improve outcomes. So if we can build a trusting relationship between the school, the individual, and the provider, that is definitely going to help our students or our colleagues in the long run. As part of that, and this happens in all schools, and it does happen really well, we need to be able to keep that child and young person at the centre of all our planning. What I'm hearing from my students right now is that keeping the child and young person at the centre of all the planning really ensures that the right pathway is found. However challenging it is to find that pathway, keeping that young person at the centre of all of their thought processes helps them to find that pathway for that individual. An interesting one that has come up as well is the need to train our staff within our settings to actually work with those professionals. So we need to understand what those professionals external to school actually do. What is it that CAMS does and CAMS doesn't do? How do we know who the right person or the right organisation is to actually refer to? And most importantly, how do we work with that partnership or work within that partnership? What evidence do they require from us? What data or observational inputs do they need? How do they need that to be presented? So let's find out exactly how we can make that partnership work through those really good communication approaches and through those evaluations that we can then do to support the external professional in getting the help that our students need. So I suppose to effectively collaborate with mental health professionals and external agencies, we need to keep the child and young person at the centre of all of our planning. We need to build those partnerships to make sure that our relationships are built on trust. We need to ensure that we are regularly communicating with these external agencies and mental health professionals. And we need to ensure that we understand what it is that they do and what they don't do and how they can help us or can't help us. And if they can't help us, who can? And at the part of all of that is to establish those clear referral pathways so that we are able to make sure that the young person or the person in need gets the help that they need.